The experience of a typical person who needs medical attention in the UK is first to reach for the phone. And typically, you feel at your worst when it's out of hours, it's at the dead of night or it's a weekend. So people tend to feel a little bit helpless. So what we have is an NHS helpline, which is there are qualified people who will answer the telephone, and if they feel that they can actually direct you to an easy care option, they'll give you that advice over the telephone. If they think that it is actually showing signs of some danger, if it's like meningitis or something, and they pick that up, they will refer you to an emergency facility straight away. So, you have to make that decision over the phone, whether it's something that can keep until when your general practitioner is back to see you and you make a regular appointment, or it is so serious that you just go to an emergency facility, an ER facility within a hospital, and that range is available to everyone. We also have, in more extreme situations, general practitioners who will just do house calls. The real trick is to make sure that is used properly, because each patient that a visitor sees means that it's at the expense of maybe 5 other patients that person could see elsewhere. The appointment system on a regular basis is done by telephone, so you get a regular slot with the general practitioner. So I still believe that the British model has some benefits, which is that you go to somebody who has a good understanding of medicine, can either treat you there and then, or actually tell you don't need a treatment. If it's a viral infection, just go and lie down, drink, and don't bother with medication. People can over-medicate as well. So quite often our doctors will say, you don't actually need anything. And people feel very disappointed. Why don't I have catheter tubes and medicines and a prescription? And quite often a placebo will actually have the desired effect. But for more serious illnesses, a general practitioner can really direct you to a specialist, a consultant, and then the medical treatment can take. They can be done here because you have the core systems are here. The people have the telecommunication links. Telemedicine, I think, is actually a better option. You can use the mobile phone thing of transferring load to one another. These are things we don't have in the UK that are being used. So I'm saying use what you have in the Philippines to your advantage. Health is all important. You can have all the money in the world, but if you lose your health, you've lost everything. And that applies to anybody in any walk of life. So when you say, is health important, it is actually very, very central. And I rank health and education as the 2 strong pillars of any society, because if you have neither, in the case of both, you rob people of their future. And we all know that really early childhood care is absolutely vital. Many of the things that will afflict somebody in adulthood, the source of that avoidable, if you like, health hazard is in its youth. So it is actually very, very important. From a local chief executive point of view, and I know many of the people on this in this conference are people who are trying to deliver healthcare at the point of delivery. It's not a question of which system is better, whether it's sort of dominated from the center or whether it's something that is delegated down. And in the Philippines, you have a much more delegated system. And one should then use that as a strength, which actually means that the lines are there in terms of for the budgets to flow, for the information to flow, and for the healthcare system to go down the chain. What I'm really heartened to hear is that in this gathering today, you've actually brought together people from all parts of the system, from government, from LGUs, from the medical profession itself, and indeed people who are in the healthcare industry. Because the challenge globally is to actually bring all of that together, because everything is part of one ecosystem. And there's a tendency, particularly in government, to think in terms of silos. If you're the DSWD, you think that your issue is just looking after vulnerable people. If you're in finance, that's all you deal with. But in the end, it is all of it coming together. One of the recommendations that I made soon after the devastating experience of Typhoon Yolanda here was the task force approach. That you can't just say to somebody, you're in charge of rebuilding homes, you're in charge of healthcare, you're in charge of rebuilding roads, because they're all part of the same equation and they're dependencies. Very easy for me to say, but that is really the biggest challenge facing governments throughout the world. And the more joined up people are, the better the outcome. And in the end, I think it's also about not just setting the policy objectives, but by measuring success as outcomes, not as just getting the money spent is not an outcome. Just building a road is not an outcome if the journey itself is not any different. And in healthcare, at the end of the day, the metrics are about measurable decrease in preventable diseases, in reducing patient waiting times, in the efficacy of drug use, and I could go on. So it's about real outcomes, not about process outcomes. That's the first lesson. The second is really that very, very difficult choice of prioritization. And no matter how much money there is in the system, in a country like ours, in the UK or over here, there will never be enough money to provide the level of healthcare that people need. So in a very difficult way, policymakers will have to live by the choices that they actually make, be responsive to community needs, but actually then deliver what is actually needed across the board. My belief is that in the Philippines you don't have the luxury of rationing healthcare to the impoverished, because well over 25% of the country, and in some places 60% of the population, need very, very basic provision. And I think it's absolutely imperative that those needs are addressed first. So in some respects, I think you have to go back to where the NHS was, to have a slightly socialist mindset when it comes to the provision of healthcare, which is that the most needy and the most economically deprived have to become the absolute priority.